Why exactly does heat bother people with MS?
So heat probably slows down the nerve conduction, so the message that travels along the nerves, like extreme cold can do that also. And for people who have had some previous injury in specific areas of the nervous system, when there's heat or fever or exposure to sun, then you can experience transient slowing of the information traveling along the nerves. It doesn't mean the disease is getting worse, it just means that there's something that's slower, and when the temperature goes back to normal, you're back to where you were before.
What about the role of IVIG in MS?
We think there's probably not much of a role to prevent MS progression.
Okay. Do people die of MS, or what about, do people die earlier because of MS?
So if people have extremely severe MS, it may shorten by a few years their lifespan. But for most patients, they have a normal lifespan.
Okay. And how many people have MS? They say there's 400,000. Is that true, or are there more?
We don't have real numbers. It's possible that it's more, but we don't know.
Can I add
Nancy,
something to that? I know that that number is absolutely impossible, and I think it's closer to 2 million people have MS. We did a Zogby poll and a Gallup poll quite a few years ago and proved that, and I don't know why that number has stayed the same for the last like 30 years. It's not, it's absolutely 38 years. That's not true, and I don't know why we can't seem to change that, because I know that if you can prove that a larger amount of the population has a disease, the government has to fund a larger amount, and that's, I don't know why that's impossible. But we did try to do that. We did 2 of the most important polls, and it seems that nobody wanted to react. But I think it's really important to know a lot more people. I think it's closer to 2 million.
2 more quick questions, and then we'll let Dr. Wabant catch your plane. Any research being done on the relationship between autoimmune disease in the family, MS, diabetes, scleroderma, et cetera?
So there's lots of research about that, because some of the genes are actually, the genes involved in MS are also involved in other autoimmune diseases. So there can be some genes that seem to be master switch of developing autoimmune reaction.
And the final question is, having cancer affect MS or treatments?
It depends on the kind of cancer. There are some treatments for cancer that actually may benefit MS. The thing is, when you have cancer, you have to really focus on treating it the best and talk between your neurologist and your cancer doctor to try to maximize your treatment and avoid side effects in case some of the drugs, for example, decrease your lymphocytes and so on.
Emmanuel, great job. Thank you very much.
Thank you.
So we're going to, Dr. Peltier, here's a couple questions that relate to primary progressive MS, the use of Rituxan, other drugs, the MRI in primary progressive MS. What are your thoughts?
So the first thing is primary progressive MS is a subtype of MS. About 10% to 15% of our patients have this type of MS. It's a disease that actually tends to start a little bit later than the more common form, relapsing remitting MS. We currently do not have an FDA-approved therapy for primary progressive MS. When patients, unfortunately, have a rapid decline or MRI lesions, we tend to treat. We want to help, and then we use medications that are off-label. And in such cases, rituximab is an option. There's been a large phase 3 placebo-controlled study in primary progressive MS suggesting that patients who have active MRI lesions may actually benefit from the drug. So at times I do treat with rituximab, but again, primary progressive MS, 10-15% of our patients. It may be a different subtype of MS, but we're not sure yet if it's exactly the same as the relapsing form of MS.
Very good. Here's a question for you, Jack. I mean, we're looking at all the things. Here it says you ran with the bulls, you climbed sea cliffs, defeated a Thai martial artist, et cetera, et cetera. But so then the question comes up about pain and symptoms of MS. So what are your comments on that? Have you had any pain when you talk to other MS patients? Is it painful, and how do you deal with that?
I've been fortunate enough to where I haven't experienced pain per se. I have, I had optic neuritis was the reason I went to the doctor. But before that, it was kind of numbness and tingling in the legs, and now I just have a hot leg, which is kind of strange. I have one hot leg.
Hot leg. Yeah.
Yeah. So.
You're one hot guy.
Right. I mean, I guess it goes. I still remain as active as possible. I do, 24-hour adventure races still, and even though my doctors are like, don't do that. A lot of it is about kind of keeping, I think my head in the right place sometimes more so than my body. If I know I can continue to do something, if I know that it's not stopping me, I'm not going to let it stop me to a degree. So I still try and be as adventurous and reckless as possible, or with as safely as possible. But it's a healthy balance. It's with anything. I'm learning with MS, it's all about healthy balance as far as with the exercise and the diet and because it's always changing, you have to kind of change with it.
So very good. Thank you very much. You segued into something that I'd like to ask Dr. Leslie Weiner, and that's exercise. What are your comments on exercise in MS?
Yeah, there is a mounting evidence related to exercise and a whole host of functions. Actually, Nancy is supporting some fundamental research in exercise and models, but quite clearly there is a significant body of data which shows that exercise stimulates stem cells. Those are the ones that are there already. That exercise will be immunosuppressive if you do it enough. And the third is it is certainly a treatment of depression and mood changes. And the final point is you look better. But the time and the experience is always difficult. It has been our feeling, and by the experimental models, that you have to do this basically every day. It doesn't seem to last, unlike a cardiac exercise where you could do it 2 or 3 times a week, plus the fact that it doesn't have to be that vigorous. So people in wheelchairs really could exercise if they exercise their upper extremities or if they do isometric contractions, etc. But there is a mounting evidence that this is a critical component of immunosuppression, repair, and certainly it's important for cognition as well, at least in terms of mice and rats running mazes. If you put them on a treadmill, Rusty Gage had his rats on a treadmill for 24 hours, 12 of 24 hours. We only think that people need to exercise for about a half hour a day, and of course some of us don't even do that. But quite clearly, this is a major component of understanding the interaction between all of these factors, and particularly immune factors, and the repair and function of the nervous system.
So I think we've come towards the end. I just want to personally, on behalf of myself and everybody, thank Nancy for the wonderful, wonderful I was been here from the beginning. I remember going to Aspen. I remember Nancy's father buying sandwiches from my father's deli in Denver. So we go back a long way. But Nancy, we love you and we thank you for everything you're doing.
Thank you. Thank you, all the doctors here. I'm always learning so many things. You're so brilliant, and I appreciate your dedication to helping find a cure for MS. Everybody, thank you for being here today. And if you have any further questions you want to ask, feel free to ask anybody you want. Thanks. Bye.